How has your experience bringing together multiple state Medicaid groups to have collaborative conversations informed your ideal for what teamwork can do to make a greater difference in public health?
I think one of the real strengths of collaborations is this idea of knowledge sharing and information sharing. In my work that I'm currently engaged in Portland, Oregon, one of the things that we do is we bring together, anywhere between 10 to 15 state Medicaid programs, and they share some of the challenges that they're facing. So right now, in 2009, 2010 was a historic recession. State budgets are being slashed, and people are losing health insurance, so they're getting put on the Medicaid rolls, and funding for Medicaid is decreasing, so you have these competing pressures, and no one has a silver bullet for how to deal with this. We can't just raise taxes because no one's employed, so we can't even pay taxes even if we wanted to. So there's a lot of innovation going on at the state and regional level, and states can learn from each other, and states can share tactics on how they got through a particular difficult legislative session, or how they got through a difficult budget session, or they can share stories about how they've applied, comparative effectiveness research. There's a lot of political interest in autism, and a lot of states have legislation that's either being introduced or being debated in their legislatures about entitlement benefits for autism treatment. And so states can sort of get together and share, this is what we did in our state that really works for this population, or this is what really didn't work, or this is the challenge that we faced in just talking to some of the advocacy groups. At the state level, a lot of decision making is very participatory, and we love that, because if you just legislate a decision without any debate, then people can feel very disenfranchised. So getting people together, if one state is sort of on the vanguard of a decision, and the other states can learn from their experience, and that helps everyone. We always say that the big joke in the industry is if you've seen one Medicaid program, you've seen one Medicaid program, because they're so different. But at the same time, a lot of the challenges that they face can be very similar, and if one state decides to tackle a particularly difficult issue, then they can sort of turn around and say, fair warning to the rest of the states, this is what you may come across. Or if a state has a particularly innovative solution that really worked, then the other states can pick up on that. So one of the things that we found is that the state of Alaska has been very, very pioneering, because the vast geographic areas that they have to cover in their services, they've been very pioneering in using sort of paraprofessionals, auxiliary providers. And it was fairly non-controversial in Alaska, where they had a lower level than a physician providing care. And this is something that a lot of states have decided to start now. And Alaska's been doing it for 20 years, and they have great health outcomes. And now other states are starting to learn from that lesson and saying, wow, do we really need a physician everywhere? Maybe we can have a nurse practitioner, or a physician assistant, or a dental hygienist, and they start looking at different levels of care.